Welcome back to LoveRose Talks. We are here with Isabel White, who is a cancer care nurse and a sexual therapist. And in our last video, we discussed the struggles with intimacy after a breast cancer diagnosis. And so the two most common sexual concerns are a reduction in sexual desire and arousal and sexual pain. So in the next two videos, we're going to talk about the practical advice surrounding those two topics. So Isabel, if you could just discuss the practical advice surrounding firstly a low sexual desire or arousal.
Thanks. Yeah, absolutely. I think sometimes we imagine that there is no point in starting to be sexually intimate if we don't actually feel that desire or arousal at the beginning. But in fact, that couldn't be further from the truth. If we make sexual intimacy a priority for us and our partners, and we actually set specific time aside to be intimate at a more frequent kind of level or at greater frequency, then that's something that we can both agree to and something that can actually be really useful. So being able to engage sexually with your partner without necessarily waiting for spontaneous desire or physical arousal to be there can often help you develop what we would refer to as responsive desire, which is much more common in women anyway. And so when you begin that intimate play together, you begin to feel connected to your partner. You enjoy relaxing, hopefully, and being physically intimate together. And that can actually mean that that connection, that sense of intimacy then leads to you beginning to have those feelings of arousal and desire that you're used to experiencing. I think generally as well, it can be really helpful just to increase the kind of direct expression of affection to help promote that sense of intimacy and connection. So that might be tricky for couples who feel, well, they're not very touchy-feely anyway, but actually just being able to kind of be more expressive towards each other, even if it doesn't lead to overt sexual behavior, can be a way of helping you feel connected and feel that you and your partner are actually making that time to be close together. You can certainly try what we call low demand sexual or sensual activities together, such as mutually massaging each other with some nice body lotion, taking a bath or a shower together, for example, kissing and hugging and holding and being close in terms that aren't as demanding as perhaps trying to have full intercourse together, but allow you to begin that connection and actually gradually build your confidence and see how you can be compassionate and kind to each other, and actually allow that intimacy and physical closeness to develop and evolve. But while doing that, of course, we've also got to be very respectful of sexual boundaries. So it's really important that we don't overstep those boundaries. And if we're feeling vulnerable on that occasion and we don't want to be touched and we don't want to be kissed, then being able to gently say that in a way that your partner can hear can be important for many women and partners as well. I think in terms of boundaries, many women say to me that the reason they don't start any physical connection with their partners because they're frightened that it will then lead to intercourse and they don't feel ready for that. So again, if you're able to talk about it with your partner and say, well, actually, on this occasion, I don't want us to have full sex, but I'd really like to just kiss. I'd really like to just touch you and be touched. And have you both agree to those boundaries and then respectfully keep to them. That can mean that you're more likely to relax and enjoy what's happening between you than worry about it escalating into some aspect of sexual expression that you're not ready for. And that can be helpful for both partners in terms of enjoying it and relaxing. If it's acceptable to you and your partner, you might want to think about maybe buying a sex toy or using a sex toy you maybe have hidden in the drawer for a long while and haven't been near. Because using things like vibrators can be quite enjoyable for both men and women, and they can help you experience different sensations in different parts of your body. And they can also help you feel that you're perhaps becoming a little bit more physically stimulated and aroused than might be happening through just using hands or using tongues or whatever else you want to engage in together. I think it's important to recognize that your body may take longer to respond because of the treatment that you've either been through or that you're going through currently, and that the route, if you like, to you feeling turned on and being sexually aroused may end up being different from how it was before your cancer treatment and diagnosis. So again, it's about learning what those new and different routes might be for you both. You might want to think about what sexual pleasure actually means to you and your partner. You may want to redefine what it is, and try new and different things that you can relax and enjoy together, and maybe expect sex to be different after treatment, but not necessarily always worse. I think quite often I say to couples, think of lovemaking more as a process rather than a performance. So that you're focusing on the journey as much as the destination. And particularly focusing on your own self-esteem and your sexual confidence and being able to rebuild that, rather than on anything that's based on notions of what being perfect is about, or having a perfect body, for example.
So that's really good practical advice, Isabel. But I just have a question. If, for instance, you are dating after cancer and you are not in that long-term relationship where you have the opportunity to discuss with your partner who knows you very well, if you're out there dating again, how do single people navigate that conversation? What advice and signposts would you have for somebody in that situation?
I think that's an incredibly important question, and one that we often forget to address. You're absolutely right. I think the way you would approach it is very much inherent to the type of personality that you are and the way that you approach other challenges in life. But I think for some ideas about how you might take that forward, the source of help I found most useful to signpost patients I was working with who were in that situation was to go to the Shine Cancer Support website, which is a charity for adults in their 20s, 30s and 40s who've been affected by cancer and who have a cancer diagnosis. And on their website, they've got a fantastic podcast about dating after cancer, which talks about the sorts of things like, you know, should I tell somebody even on my dating profile that I've had cancer treatment or not? When, if I meet somebody, should I tell them that I've been through cancer treatment? And if we're going to become intimate, do I want to share that information with them in advance, or do I want to wait until we've got to know one another and taken time to get to know one another before I broach that subject? So they do such fantastic justice to that whole subject area. They also had a recent 2020 Shine Cancer Connect remote meeting, and there's a great webinar on the YouTube channel that Shine Cancer Support have, which is for younger adults talking about what it's like to date after cancer. So again, lots of tips about, you know, practicing what you want to say and practicing that with a trusted friend and things of that nature that just help you imagine how you might go forward and actually approach that subject with a new partner.
We'll pop everything, all of the information on our website so you can follow all the links straight through, and tune into our next video where we'll be talking about the practical advice for sexual pain.